Nyajong Gulumbe Hua Natalie Dolly Shong.
Najong Glumbewa Hannah Martin.
Nyajong Golumbe Hua Marie Montgomery.
Nyajong Gulumbe Hua Emily.
Najong Gulumbe Hua Karina Ortega. Today we will explore the topic of insightful perspectives on mental health clinicians on the nuances of mental health within the Hmong community. Our leading question was, what do Hmong clinicians see when giving mental health services to the Hmong community? Our interview was conducted with a Hmong clinician in Fresno, and the covered topics were as followed.
Our first covered topic was family dynamics and culture. The findings about family dynamics are that people fear using their voices against a family member. It is challenging to come forward with information about a spouse, family member, or community member, as it would damage one's reputation or one's family. Agencies within the Valley help individuals empower themselves with resilience to overcome these barriers. With guidance and support, Hmong clients can seek support for themselves and include their families, since mental health clinicians know the importance of the whole family dynamic. They can also seek support for themselves only and keep it confidential.
For the religious and spiritual findings, it was found that Hmong communities' hesitation towards Western medicine or therapy is rooted in the concerns of how their spiritual beliefs and their practices will not be perceived. This includes shamanism, Christianity, and others. The fear of stigma is not also just about their personal reputation, but it also touches deeply on health, cultural, and their spiritual values. Therapy then becomes a challenge to the Hmong community because it involves sharing their personal experiences, which may include the spiritual or the religious elements, in a context where such beliefs may not be understood or so respected.
Now looking closer into unhealthy relationships within the Hmong community, the findings were that unhealthy relationships within the families and individuals are going to face many challenges when it comes to seeking the supports that they need and ways to improve or change their situation. And these limitations are more barriers to seek those professional helps.
And for multi-substance usage, the findings of multi-substance usage were limited due to the minimal reports within the agency and the community. But we do realize that there are several barriers to seeking mental health and familial support for individuals who are being challenged by the multi-substance misuse.
As for the topic of coping mechanisms, it was emphasized that coping skills are tailored to each patient through exploring hobbies and activities. These hobbies include hiking, gardening, singing, fishing, and more. At times, Hmong clients are already engaging in these daily activities and have noticed that they have had a positive influence on their mental health without realizing that they are coping skills.
Now, taking a closer look into application, we ask ourselves, how do the Hmong clinicians use their approaches in practice to support Hmong families and individuals? Our interviewee used a culturally sensitive approach that best fit the Hmong community. They understood how the historical trauma, family dynamic norms, and ways of living were different for this population compared to other ones that needed trauma-informed care services. The resources that our interviewed person provided and the interventions that they used made all her clients have a familiar sense of comfort and trust that they can't easily find in modern-day therapy services.
So what can we learn as clinicians, social workers, and this is our implications. So our leading question is, how will findings be integrated into future social work practice and mental health clinicians and into the community? So as social workers, it is important to be culturally sensitive and competent and to understand the Hmong culture, tradition, and community. These findings within our interviewees will aid our knowledge in providing services in a respectful approach in the Hmong community. Therefore, this will guide our professional growth and implementation when working within our Hmong community in the Central Valley.
Thank you, Natalie. So what we learned this year is that we have gained extensive insights into the intricacies of the Hmong culture, recognizing the pivotal importance of cultural competence when engaging with Hmong clients. Cultivating such competency is indispensable in facilitating the support needed by Hmong individuals and aiding them in adapting to the Western milieu.
We would like to thank the grant for this opportunity and all of those who made it possible for us to really gain a deeper understanding in the Hmong community and have us help and explore different practical ways to support them in overcoming their mental health hurdles. Thank you, guys.